So my name is Asanda Shabalala, born and bred in Potchefstroom, Kamalaka Township. So I did my primary high school there, finished in 2013, and then I went to do my studies at UCT for my medical undergraduate. So I graduated in 2019, and then I went to work at Ngulizane Hospital from 2020 to 2021, which was during the times of COVID-19. And after that, I went to work at Rifle Hospital, which is under a Herkwala district, where I did my ComServe in 2022. So from there onwards, from 2023 onwards, I've been working in the NGO space, and I find myself now working with Health Systems Trust for the Cervical Cancer Prevention Access and Control Project. On first encounter with people that I work with, they see a young person. So that's the first thing that they see, is a young doctor that's in front of them. But once you start to explain to them that even though I'm young, there's this age gap that we have, I'm just here to serve them and help them in whatever way that they need. So that also puts them at ease, because we find that sometimes they've had bad experiences in the past with other medical officers, but if they see someone new that they don't know, they are able to open up, and we are able to engage on the matter that you're wanting to convey. Especially with cervical cancer, which is an area that's not spoken about a lot. Yeah. It's an area that we need to look into and educate and raise awareness for our community, because there's a lot of misconceptions, and sometimes there's a lot of stigma, because you know that within our population there's this issue of high prevalence of HIV, which sometimes goes hand in hand with the cervical cancer. So if you're tackling cervical cancer, you also need to tackle the HIV side of things as well. So it's embracing and integrating all your knowledge so that you are able to convey it to the population at large. I think from a very young age, I wanted to be a doctor. I wanted to help people. So I had the passion and a desire to help people with that. So that's what influenced me to be in this space. So I think it's my people's approach in everything that I do. So the relationships and the communication that I build with people. So from the team that I work with, and stakeholders that we work with, because we work along with medical officers, your nurses, and the various facilities, your clinics and hospitals. So it makes it much easier if you are approachable to people, because that's the foundation that I have and the charisma that I bring, which makes it much easier to sort of like work together and not have any major problems that I encounter in my field. So it's been a lot of work, because I only came in April to join the team, and they did embrace me very well, and I was able to, within the first month, be very comfortable with the team that I was working with, and be comfortable with the stakeholders as well that we are working with. Yeah, it's been quite a journey, because even now, within the past 3 weeks, we've been traveling Zululand district, visiting the facilities. So it takes a lot on you. It takes a toll, like that traveling, because if you travel for like 2 hours on a day from one facility to another, from one sub-district to another sub-district. So it's been quite a journey in terms of that. But with the challenge that we usually see is that people present late with cervical cancer complications. It's because of the cultural background that they have and they follow. So sometimes they might delay presenting to the clinic or the hospital, but you also need to inform them that by delaying their presentations, they prolonging the problem, which is the cancer. So it's sort of like progression, and presenting late, and then you find that it's much difficult now to sort of like treat it at later stage. If you had come earlier on, you'd find that we've been able to be cured of the cancer. Yeah. So it's very much that balance between the two, the Western medicine and also the traditional medicine as well, because so that you are able to provide a holistic and a comprehensive care to the patient. So in terms of advising a person, it'd be to work hard, be consistent, and be adaptable, because times are changing, so you need to adapt to your surroundings and also have a passion for working within a rural community. Because I find that if I didn't have a passion or have this upbringing that I have from a rural perspective, I wouldn't be able to fit in very well. So you need to sort of have a good background, so to say, for you to be able to fit in within a workspace that you want to work at.